Hello everyone, thanks for the opportunity to let you know about advanced training in the psychotherapies for psychiatrists in training. I'm going to run you through a little bit about psychotherapy this evening and hopefully get you to be interested and curious about what it holds for you and for your future. I'm Jeff Streimer. I'm the New South Wales Director of Advanced Training in the Psychotherapies, and I work in private practice and in public practice. And in private, I'm at the Amaranth Centre in Sydney. Well, first of all, let me ask you a question. Why are you interested? Why are you interested in psychiatry? And if you're interested in the why, not just the what, and interested in trying to find out the meaning of what you're doing, and perhaps more broadly, the meaning of what life holds for you, then you're also going to be curious about learning more about who you are, who others are, and hopefully developing a holistic and whole way of thinking about yourself, your body, brain, with your mind, and also your sense of yourself. Psychotherapy will help you to learn about the real meaning of mindfulness, how your feelings, emotions, thoughts, and actions form and how they're linked, and also how to mentalize, how to observe and know what's going on inside yourself, and consequently to be able to empathically understand what others are likely to be experiencing. All that will be enhanced by experience of psychotherapy training and practice. So it'll help you to pull the pieces together. It'll help you hopefully be a well-rounded psychiatrist who gets to know and understand patients, their minds, and also our own minds. It'll also give you a deep sense of satisfaction in your working life. And psychotherapists and people in psychiatry who pursue psychotherapy as part of their practice rarely, if ever, burn out. It's also very satisfying in that you can produce effective, lasting and meaningful change in those who you see. So this training can help you as a person and a psychiatrist to really confidently understand complex human nature. We aim to help you gain the keystone to bind, support and enhance all of your clinical learning to date and into the future. It'll help you to work effectively with the widest range of patients in real practice, and also to get, of course, the specialist skills and knowledge to change your patients' lives. So today I'm going to run you through some of the commonly asked questions, the Q&A about when to do psychotherapy advanced training, about what it is to do that training, hopefully to explain a little bit about how it works, and also to help you sort out if it's for you. So let's start. When can you do it? Well, as you will probably be aware, Stage 3 opens the door to advanced training, and you can do it onwards any time from your registrar status through to an early consultant or even later consultant practice. And amongst the people who we've been fortunate enough to help train in advanced psychotherapy skills includes such well-known figures as Mari Bashir, former Governor of New South Wales, and others who came later to advanced training in psychotherapies. It's got a parallel relationship to attaining fellowship, but it's not strictly linked to it. The only stipulation of entering fellowship in terms of the advanced training in psychotherapies is that you have to have done, but not yet passed, your PwC, your psychotherapy written case. And indeed, you don't have to fit it into the narrow envelope before attaining fellowship, and you've got up to 6 years to get through this training. Some people do it in less time, and others take their time. So those two issues, being a fellow, becoming a fellow, and doing and attaining the psychotherapy advanced training certificate, are uncoupled. By the way, There's no demanding exams or dissertation to submit, although we encourage you to do learning at your own pace. So that's a bit about the when. In terms of what advanced training in psychotherapy offers, there's 4 chapters, roughly, of the psychotherapies. The most commonly done is the individual psychodynamic psychotherapies, so-called IDP, and that offers a multimodal approaches to dynamic psychotherapy. It's very psychiatrist-based, and it's the most popular choice. But in addition to that, there's a choice to do brief and structured psychotherapies, to do couples and family psychotherapies, or group psychotherapy. And it involves several elements. First of all, there's a formal education component. That starts out as a core that goes for 6 months and introduces the modalities that I've just listed, been through with you. And beyond that, it extends on to 2 years in which you go deeper into your chosen chapter. And also after that, we regard this as an introduction. There are opportunities for ongoing engagement and learning. And many people go on beyond that. In fact, psychotherapy is a lifelong learning experience driven by your own interests and needs, and is a lifetime pursuit. It's very practical. There's a practice-based clinical case requirement and supervision that accompanies that. These aren't enormously demanding, but it's best if they're undertaken alongside the actual clinical work that you're doing in your general psychiatric training or practice. You can do all of the certificate requirements or part. Some people come mainly for the didactic learning. Others want to go more deeply and fully into the case supervision and case experience. And unlike the other advanced training in the psychotherapies, and you'll already see that since it's not time limited or time based, it's also not based in a particular post or setting. So you can do it from wherever you are. It progresses on the basis of seeing the underpinning of all of this as a development that is ongoing throughout the patient's life. And as such, it's really a supported, autonomous adult learning experience. Perhaps, dare I say, very different to some of the experiences that you've had so far in your training. So it's very much centered around your progress, your needs. So how does it work? Well, it's run in New South Wales, out of the college headquarters, but it isn't primarily orientated towards the college beyond the requirements for the certificate. It's offered face-to-face, and we encourage people to come along, and it's also available to be done either partly or largely online. We've organised it so that it doesn't interrupt people's lives too much, so it's on a Wednesday evening from 6:30 till 9, and we give you a meal halfway through to have a chat, to meet your other colleagues and to meet the people who are your seminar leaders, and also the people who are in the associated year. So there's a first year of the FEC, formal education component, and the second years, and they get together to get to know one another, and forming a peer group is very important. Usually each year is composed of a relatively small group, but roughly about 5 to 10, depending on what's happening that year. It's very flexible. It's orientated towards your needs, and for those who are concerned about it, it's not an expensive thing to do. It'll offer you theoretical, as I've said, and practical training, and it's also very skills-based. So it'll integrate with other modalities of advanced training or practice that you're involved with. And over the time, we've had lots of people who are generalists, who are interested in learning psychotherapy and in integrating psychotherapy into general psychiatric practice, but it's also able to be dual with other people doing other advanced certificates over time. All are invited, but quite frequently people doing CL or old age or child and adolescent or forensic training often realise that they will benefit from doing further psychotherapy training. And as I've already said, it's a pathway. It offers multiple pathways to ongoing learning and to the really wide world of psychotherapy, which overlaps considerably with psychiatry, but goes well beyond it. And the way it's done, we hope to support you, to listen to you, and to evolve. And as part of this, we have active, true 360-degree feedback where you get your say, and seminar leaders and people helping run the course are giving your feedback. And year by year, that makes a real difference to the way we run the course and the way we present. So that's a bit about the how. Now, who's it for? Well, generally, I'd say it's on for young and old. You'll be taught and led by, and will meet really leading practitioners in the area, largely psychiatrists, but also people from related disciplines, other senior psychotherapists who aren't from a psychiatric background only. It's a great pleasure and honour for us to be able to get you to meet these people and see really how engaged and how engaging and exciting doing psychotherapy can be. You get to choose in due course your own senior psychotherapy supervisors, both in the public and the private sector. And it's also, it lends itself very much to psychiatric practice, both public and private. And you can decide how far you take it, what you want to do, whether you're going to incorporate psychotherapy as part of your practice, or whether you're going to decide largely, as have I over time, to become a specialist, a subspecialist in psychiatric psychotherapy. So all these options are going to be open to you. So look, really, I'm just happy to have had the opportunity to let you know that advanced training in the psychotherapies, a really engaging learning experience delivered in a flexible way at a pace that suits your lifestyle, and that'll help you to open the doors to a hugely enhanced, richer experience of your psychiatry career, really helping people to get well and stay well, to get to know your own and your patients' experiences of life through illness and towards better health. So thanks for checking it out. Hopefully we'll get to know you and see you. Feel free to approach me or the college headquarters so they'll guide you and direct you towards advanced training. And I look forward to meeting you in person in the near future or later, as it suits you. Thanks.